Most Texas seniors are overpaying on Medicare because they don't understand these four things. In the next 3 minutes, you'll understand Medicare better than 90% of people. No jargon, no confusion, just the facts. So what is Medicare? It's the federal health insurance program for Americans 65 and older. It also covers certain people with disabilities. Over 67 million Americans are covered, including 4.2 million right here in Texas. And it comes in four parts. Let's walk through them. Part A is your hospital insurance. It covers inpatient hospital stays, skilled nursing care, hospice, and some home health care. The good news? Most people pay zero premium for Part A, but there is a deductible. In 2026, that's $176 per hospital stay. After that, Medicare covers the first 60 days fully. Part B is your medical insurance. This covers doctor visits, outpatient care, preventive services, lab tests, and medical equipment. The 2026 premium is $185 per month with a $257 annual deductible. After that, you pay 20% coinsurance, and here's the catch. There's no annual out-of-pocket maximum with original Medicare. Now, Part C, Medicare Advantage, is where things get interesting. These are private plans that bundle Parts A and B together, often with extras like dental, vision, hearing, fitness programs, and even transportation. Many Texas plans have $0 premiums, and unlike original Medicare, Advantage plans cap your out-of-pocket costs. The trade-off is you typically use a provider network. Part D covers prescription drugs. Big news for 2026, there's now a $2,000 annual cap on drug costs. Once you hit that limit, you pay nothing more for the rest of the year. Average premiums run about $46 per month. And don't skip enrollment. Late penalties are permanent. When should you enroll? Your initial enrollment period is a 7-month window around your 65th birthday. Annual enrollment runs October 15th through December 7th. And if you're already on Medicare Advantage, you can switch plans January 1st through March 31st. Miss these windows and you'll face permanent premium penalties. That's Medicare in a nutshell. For a complete free guide tailored to Texas seniors, visit texasmedicareseniors.com. Like this video and subscribe for more Medicare tips. We'll see you in the next one.